this video, I'm going to talk about what pelvic pain needs to heal. With all of the discoveries of modern medicine, there remains a certain arrogance in the idea that medicine is the source of health and longevity. Yes, we live longer, and illnesses and conditions that killed our ancestors are cured by the remedies of modern treatments. But also, we forget that the healing of the human body requires the services of the body's natural ability to heal itself. The body's ability to heal itself is essential for the efficacy of any man-made remedy. We cut ourselves and observe over a week or two that the torn tissue heals. In order to facilitate this healing, we have to clean the wound and protect it from what interferes with it healing up. How amazing would it be if a car that had a crushed fender could spontaneously fix itself when left alone for a few weeks? But this is what the human body does, and we tend to take it for granted when admiring all of the accomplishments of modern medicine. Modern medicine depends on the body's innate ability to heal. The focus in modern medicine on miracle drugs and new technologies leaves out a fundamental reality. Without the body's ability to heal itself, no medicine heals anything. Needless to say, giving the most amazing medicine to a corpse will do nothing. In our work with pelvic pain, I see that the only use of any medical intervention is to honor, cooperate with, and enable the healing mechanisms of the body to work on what is injured or troubled. What we often consider remedies for illnesses and disorders are really only support mechanisms for the body's natural ability to heal itself. Any successful treatment of pelvic pain must cooperate with the body's intrinsic ability to heal the sore tissue of the pelvic floor. This insight is crucial in the resolution of pelvic pain. Many patients with pelvic pain hanker for a miracle drug or procedure to relieve their suffering. Most have been deeply disappointed in not being able to find such a remedy. When I myself suffered from pelvic pain, I forgot a very important thing. No medicines or procedures or technologies are necessary for people who don't have pelvic pain to remain out of pain. People who have no pelvic pain have a body in which the pelvis is not sore or painful, and the body continues to maintain the pelvis in an easy and pain-free state without interventions of any sort. Return to this kind of body is what we need when we have pelvic pain. And so the question is, how do you get there? Not such an easy question and answer. Let's remember that our bodies want to heal themselves. The pelvis does not want to hurt. The question is how to help the body in its biological intention to be without pain. It has become clear to me over the years that anything that helps pelvic pain must cooperate with the natural healing mechanisms of the body. So this raises two important questions. First, can pelvic pain heal even when it has gone on for a long time? I say to you that the answer is yes, and my personal example is that I recovered after 22 years of being in pain, and I'm not the only one. Second, how can we help the body's innate healing mechanism restore health and stop pelvic pain? In order to answer this question, you have to understand what gets in the way of the body healing the sore pelvis. While we don't help everyone, the significant reduction or absence of symptoms is possible for a majority of our patients. This is often forgotten by the patient because the most distressing aspect of chronic pelvic pain is its chronicity, how it seems to stubbornly hang around no matter what a patient or doctor does. For most of those years I suffered from chronic pelvic pain, I doubted anything would help. When I was in chronic pain, I couldn't imagine being out of pain. When I was in pain, I didn't understand why my pain and symptoms wouldn't go away like other aches and pains. Like many pelvic pain patients, I worried that I was a goner, that somehow my pelvis was beyond the reach of getting better. Only after many years after I started getting better did I become clear of what was necessary to help me heal. So I want to talk about cooperating with the healing mechanism of the body. When I recovered from pelvic pain, as is true of our patients who recover, a key component of my path to health was regularly physically loosening my sore, irritated pelvic muscles. At the same time, I found that I needed to create an environment where loosening and easing of my sore pelvis was not disturbed by the stresses of normal life. I achieved this through a method of becoming both physically and mentally quiet, as we teach our patients in our 6-day immersion clinic on what is now known as the Wise-Anderson protocol. So why doesn't pelvic pain spontaneously heal? Sore pelvic tissue is typically caused by chronic anxiety-related tightening of the pelvis. Injury in a minority of cases also can trigger this pelvic tightening. But usually it's that someone is anxious, tightens the pelvis up reflexively, and over time the pelvis doesn't relax and remains sore and irritated. The irritated pelvic tissue triggers a reflex in the pelvic floor to tighten up against the pain already there. This reflexive tightening imprisons the sore pelvic tissue in a chronic constriction, preventing it from healing, much like a broken leg that is continually walked on. Chronically irritated and tightened pelvic muscle tissue can throw a wrench into the normal functions of life, disrupting normal urination, defecation, sexual activity, and just sitting. Throwing insult to injury, catastrophic thinking that the pain will never go away contributes strongly to the tightening of the pelvic tissue in its ongoing sore and irritated state. As the diagram on the screen illustrates, anxiety first leads to chronic tightening of the pelvic floor. Now, to reiterate, in our pelvic pain treatment, we teach our patients to do internal pelvic floor physical therapy on themselves 3 or 4 times a week with the goal of temporarily freeing the sore pelvic tissue from its reflexive guarding. As pioneers of using pelvic floor physical therapy for the treatment of pelvic pain, we have treated many patients. We developed the only FDA-approved internal trigger point wand and established clear instruction for patients to do their own internal trigger point release. When done skillfully with practice, we believe the patient becomes their best physical therapist. While essential, simply loosening painful pelvic tissue isn't enough for it to heal. Pelvic floor physical therapy can help temporarily loosen the reflexive guarding that occurs in a sore pelvis. But the stresses of life, including the anxiety of the patient, tend to return the pelvis to its tightened state. It is simply incorrect to think that you can physically loosen the irritated, tightened pelvic floor without resolving the stress-related habit of chronic pelvic guarding that contributed to the problem in the first place. The tightened pelvic muscles are not a rusty nut on a rusty bolt that once loosened stays loosened. The immune system and the nervous system have to cooperate with the pelvis to heal it up. One of our key insights is that loosening the pelvic floor with pelvic floor physical therapy helps in the long term only when this loosening is accompanied by sufficient time and inner quiet to allow the loosened pelvic tissue to heal. In a way, practicing the Wise-Anderson protocol is like putting a broken bone in a cast and then allowing it to heal properly by regularly removing it from the activity that worsens the injury. What interferes with the healing of sore pelvic tissue is not only physical interference like sitting and weightlifting. What profoundly aggravates pelvic floor healing is the invisible activity of anxiety and an aroused nervous system. learning to profoundly relax to enable the healing of sore pelvic tissue takes time and practice. But the mind and the body are intertwined in the pelvic floor and in pelvic floor dysfunction. I am clear that treating the physical, mental, and behavioral dimensions of pelvic pain together is essential for any real possibility of resolution of most people's pelvic pain. Some have wondered why sleep doesn't provide such an environment. Actually, sleep is sometimes a more stressful time for pelvic pain sufferers than waking, as dreams and absence of distractions can crank up anxiety and nervous arousal. There is no quick fix for pelvic pain, but for many, there is a slow fix. Healing is a slow dance of physically loosening chronically contracted sore pelvic tissue and bringing it into the healing chamber of a quiet, relaxed body, day after day. As the saying goes, God cures and the doctor collects the fee. Only when we give our body the support it needs can the real healing of pelvic pain begin.